What is going on, wonderful people? It's Medicosis Perfectionalis, where medicine makes perfect sense. This video is brought to you by Picmonic. We continue our microbiology discussion. Today is part 15, in which we'll talk about many gram-negative bacteria, including Anaplasma, Coxiella, Bartonella, Ehrlichia, and Rickettsia. If you click on the link in the description box, you'll get a special discount. You also get to try Picmonic for free. So click the like button, click the subscribe button, and let's get started. You'll find all of these videos in a playlist called Microbiology and another playlist called Picmonic. In part 1, we talked about actinomyces, listeria, corynebacteria, and nocardia. In part 2, we talked about the Clostridia. In part 3, we talked about staph and strep pneumo. In part 4, we talked about the other streptococci as well as the enterococci. Part 5 was about bacillus and the mycobacteria. Part 6 about Neisseria and Moraxella. Part 7 Haemophilus, Bordetella, Pastorella, Brucella, and Francisella. Part 8 was on Legionella and Helicobacter pylori. Part 9 is Campylobacter jejuni, Vibrio cholera, E. coli, and Klebsiella. Part 10 Pseudomonas, Proteus, and Salmonella. Part 11 Shigella and Yersinia. In Part 12 we discussed Treponema pallidum, Leptospira, and Borrelia. Then in part 13, we talked about chlamydia, rickettsia, and mycoplasma. Last video was about the torch infections. And today we're going to talk about Anaplasma, Bartonella, Coxiella, Ehrlichia, and Rickettsia. So what are we talking about? We're talking about microbiology. Micro means small, bio means life, ology means the study of. So microbiology is the study of small life. We divide microbes into bacteria, fungi, viruses, and parasites. And that's why the field of microbiology is divided into bacteriology, fungology or mycology, virology, and parasitology. Let's talk about the bacteria. We use a stain called the gram stain. If the bacteria stain purple, we call them gram-positive. If they stain pink, we call them gram-negative. The gram-positives could be divided into cocci and rods, and the same goes for the gram-negatives, cocci and rods. If you want to download a colorful chart that classifies the bacteria into gram-positives and gram-negatives, cocci and bacilli, go to Picmonic and then click on Community Resources. All of the bacteria that we are going to talk about today are anatomically gram-negative. This does not necessarily mean that they stain well with gram stain. Next, the diseases. Anaplasma is the bacterium. The disease is anaplasmosis. Ehrlichia is the bacterium. Ehrlichiosis is the disease. Coxiella bacteria causes Q fever. Bartonella causes cat scratch disease. And bacillary angiomatosis, which might look similar but not identical to Kaposi sarcoma. So please do not confuse these two diseases together. Kaposi sarcoma is associated with human herpes virus 8, whereas bacillary angiomatosis is caused by Bartonella henselae. Next, Rickettsia species can lead to what? Typhus and Rocky Mountain spotted fever. We have two main types of typhus. There is the endemic typhus and the epidemic typhus. To be specific, the endemic typhus is caused by Rickettsia typhi. The epidemic typhus is caused by Rickettsia prowazekii, and Rocky Mountain spotted fever is caused by Rickettsia rickettsii. Why don't they just say Rickettsia squared? Next, transmission. Endemic typhus is transmitted by fleas. Epidemic typhus via human body louse, and Rocky Mountain spotted fever is transmitted via dermacenter tick, also known as dog tick. Please do not confuse the dermacenter tick with the other famous tick known as Ixodes scapularis, which transmits Borrelia burgdorferi bacteria that causes Lyme disease. So, Ixodes scapularis, Lyme disease. Dermacenter tick is Rocky Mountain spotted fever. Does the Ixodes scapularis transmit another disease? The answer is yes, and this is anaplasmosis. So, Ixodes scapularis can transmit Borrelia burgdorferi to cause Lyme disease. Ixodes scapularis can also transmit anaplasma, which causes anaplasmosis. We shall start by talking about anaplasma. Okay, Picmonic, take it from here.
In this Picmonic, we'll explore anaplasmosis, represented here by the anal plasma. This disease is a tick-borne rickettsial illness caused by Anaplasma phagocytophilum. It is most commonly transmitted to humans by the Ixodes tick, represented here by the X tick. This organism's natural reservoirs include deer and mice, which are shown here by the deer mouse. Patients who are infected most commonly present with flu-like symptoms. shown here literally as the guy with flu-like symptoms. These include myalgias, fatigue, and nausea. Patients may also have a fever, the fever beaver. In contrast to a similar tick-borne illness called Ehrlichiosis, a rash is rare in anaplasmosis, represented by the dermatologist examining a rare steak rash. Now let's discuss some diagnostic features. Peripheral blood smear in these patients will reveal granulocytes with cytoplasmic moruli, shown here by grainy granulocyte with more cakes. These have a classic mulberry appearance. Antibody testing confirms the diagnosis, represented by the antibody with test tubes. This is usually an IgG against the Anaplasma antigen. On CBC, patients may demonstrate low cell counts or pancytopenia, represented by the pan-side-toe-peanut. Now let's discuss management of this disease. Doxycycline, the Dachshund cycling, is the mainstay of treatment, as doxycycline will accumulate within cells, eliminating this intracellular organism. Rifampin, the Ref-amp, is another option and is preferred in young children or pregnant women. So to recap, anaplasmosis is a disease caused by a rickettsial organism known as Anaplasma phagocytophilum. Anaplasma is a gram-negative organism that infects blood cells. It is transmitted through a number of species of ticks, particularly the Ixodes species. The natural reservoirs of anaplasma are deer and mice. Patients may present with flu-like symptoms and a fever. A petechial rash is rare in these patients, which differentiates this disease from Ehrlichiosis or Lyme disease. Blood smear will reveal granulocytes with cytoplasmic moruli. Other diagnostic features include IgG antibodies and pancytopenia. Treatment options include doxycycline and rifampin.
We are done with anaplasma. Let's turn our attention to Ehrlichia, which causes the disease Ehrlichiosis.
Ehrlichiosis is a medical condition caused by a zoonotic microorganism, Ehrlichia. This ear lick will help you remember Ehrlichiosis. Ehrlichia chafensis is an obligate intracellular gram-negative rod. This is represented here by gram-cracker negative devil with rod inside cell. Lone Star tick is indigenous to Mexico and the eastern United States. This tick transmits human monocyte Ehrlichiosis. This star tick will help you remember Lone Star tick. White-tailed deer is the major reservoir of Ehrlichia chafensis. This is represented here by the deer. Immune response to Ehrlichia with resultant release of interleukins and cytokines leads to the development of fever in patients who are infected. Fever is represented here by fever beaver. Cytokine release and inflammation also leads to nonspecific flu-like symptoms such as myalgia and fatigue. Flu-like symptoms are represented here by thermometer and ice bag. Ehrlichia can mimic Rocky Mountain spotted fever in its clinical manifestations, examples being fever, myalgias, and panocytopenia. However, the rash is rare in Ehrlichiosis. Sometimes it is even referred to as spotless rocky spotted mountain fever. The dermatologist looking at a rare rash will help you remember that rash is rare in this condition. The diagnosis of Ehrlichiosis is confirmed by antibody testing such as indirect immunofluorescence antibody assay for immunoglobulin G. Antibody with test tubes will help you remember antibody testing. Pancytopenia is common in patients with Ehrlichiosis. Thrombocytopenia and leukopenia are particularly common. Anemia is less common and is caused by the erythrocytic invasion by Ehrlichia. Pancytopenia is represented here by this pan-side-to-peanut. Right Guillem's stain of the blood smear often reveals monocytes with cytoplasmic morula. The morula characteristic of Ehrlichiosis are cytoplasmic inclusions made up of microcolonies of Ehrlichia. This monkey monocyte with more sign and LA sign will help you remember monocytes with morula. Doxycycline is a broad-spectrum tetracycline that inhibits bacterial protein synthesis and is the first-line treatment of Ehrlichiosis. This dog cycling will help you remember doxycycline. Tetracyclines, examples are doxycycline, are used for the treatment of Ehrlichiosis. These antibiotics bind to the 30S prokaryotic ribosomal subunit and inhibit protein synthesis. The tetracycle will help you remember tetracycline.
Next, we'll talk about Coxiella, which causes the disease Q fever.
Coxiella burnetti, shown by the cock with the brunette wig, is a gram-negative bacteria, shown here as the gram-cracker negative devil with the bacteria. It is also intracellular, shown by the cock in a cell. It's primarily transmitted via aerosols, shown here by the aerosol can. It typically affects animal handlers, as shown by the farmer, but has also been seen in slaughterhouse workers and veterinarians. Coxiella causes Q fever, portrayed as the queen fever beaver. Symptoms include flu-like symptoms, portrayed by the ice bag and thermometer, atypical pneumonia, ATP pneumona, and hepatitis, shown by the happy Thai liver. Chronic Q fever may cause endocarditis, remembered by the donut heart card. Diagnosis is typically achieved by serology, as shown by the syrup, while management consists of antibiotics, particularly doxycycline, represented by the doxycycline. In summary, Coxiella burnetti is a gram-negative intracellular bacterial pathogen. It is primarily transmitted via aerosols and affects animal handlers like farmers, slaughterhouse workers, and veterinarians. Coxiella causes Q fever, which in its acute form can present with flu-like symptoms, atypical pneumonia, and hepatitis. Chronic Q fever may cause endocarditis. Diagnosis is typically achieved by serology, while management consists of antibiotics, particularly doxycycline.
Next, let's talk about Bartonella henselae, which causes two diseases, cat scratch disease and bacillary angiomatosis.
Bartonella henselae is a bacterium illustrated in this Picmonic as the bartender hen. This organism stains gram-negative, shown as the gram-cracker-negative devil, and is described as having the ability to take on multiple forms, or pleomorphic, the Plato-morphic jar. Often, in microbiologic studies, it is observed as a bacillus, shown by the rod. Bartonella henselae is the causative organism of cat scratch fever, portrayed by the cat scratching the fever beaver. As its name suggests, cat scratch fever occurs after a cat scratch and is characterized by the development of fever and lymphadenopathy, depicted as the lymph-Lyme ad. Bartonella henselae is also the cause of bacillary angiomatosis, which is a term used to describe abnormal proliferation of blood vessels, forming tumor-like masses in the skin and other organs. Bacillary angiomatosis is portrayed by the bat angel in this image, and an important connection to make is that this manifestation is commonly seen in AIDS patients, the band AIDS, and does not typically occur in the immunocompetent. The skin lesions mimic those seen in Kaposi's sarcoma, represented by the Mime Cape shark comb. Unlike Kaposi's sarcoma, however, bacillary angiomatosis is a benign disease, shown as the benign bunny. Rarely, Bartonella henselae can lead to reactive arthritis, the reaction King Arthur, and this is typically in those who are HLA-B27 positive. Don't forget that this bacteria is also the cause of necrotizing, non-caseating granulomas, the nun cheese-eating granny llama. So in short, Bartonella henselae are gram-negative bacteria. This organism has the ability to take on multiple forms, but is often observed as a bacillus. Bartonella henselae causes cat scratch fever, which is characterized by fever, as well as lymphadenopathy. Additionally, it can lead to bacillary angiomatosis, usually in AIDS patients. Recall that bacillary angiomatosis mimics Kaposi's sarcoma, but unlike Kaposi's sarcoma, it is benign. Furthermore, Bartonella henselae can also cause reactive arthritis, as well as non-caseating granulomas.
And finally, the story of Rickettsia.
Rickettsial diseases are portrayed in this Picmonic by the racquetball scene with rackets. These organisms are obligate intracellular organisms that require CoA and NAD+, shown by the coin A purse and nicotine cigarette character for NAD+. Rickettsial infections that cause diseases in humans include Rocky Mountain spotted fever, shown by the spotted fever beaver on a mountain of rocks, typhus, portrayed by the typhus typhoon the beaver is looking at, as well as Ehrlichiosis, the ear licking.
Additionally, Q fever, portrayed by the Q queen fever beaver, is considered a rickettsial-like disease, but comes from bacteria in the Coxiella genus.
All these diseases except Q fever are transmitted by arthropod vectors shown by the tick in the racquetball court, and have similar disease presentations including fever, the fever beaver in racquetball court, headache, the head egg lump, as well as a rash shown by the rash with the dermatologist examining it. These diseases also have a positive wheel-Felix reaction, shown by the whale on the rackets. Many of the rickettsial infections are treated by doxycycline, represented by the doxin cycling.
Also, if you click on the link in the description box and go to Picmonic, they have multiple choice questions. Here, I'll share with you a sample of 3 questions. If you know the answer to these 3 questions, please comment below. Picmonic will let you sort the mnemonics by subject and by system, as well as by your favorite book. They give you a quiz every day so that you practice active recall. And this is my method of using Picmonic. I watch the animation, and then I watch the story animation, and then I watch it once again. I pause the video and stare at the picture. I close my eyes and try to imagine and put each item in its place. Then I open my eyes and see how I did. I solve the quiz, which is multiple choice questions. I get a piece of paper and write down the place of the characters. Then I'm gonna revisit the same Picmonic on day 2, on day 5, and on day 30. And if I do all of this, I tend to remember these Picmonics for decades. You can try Picmonic for free. You can do so on your computer or you can download the app. The reason it works is that it has visual, audio, storytelling. You can read a script, spaced repetition, multiple choice questions, and you can even create your own Picmonics. For example, today's Picmonic on Anaplasma was created by a student just like you. And as we do towards the end of each video, we review all of the organisms that we discussed today. We talked about Anaplasma, Ehrlichia, Coxiella, Bartonella, and Rickettsia. All of them are anatomically gram-negative. Transmission, Anaplasma by the Ixodes scapularis tick. Ehrlichia, the Lone Star tick. Rocky Mountain spotted fever, the dermacenter tick. Coxiella does not have an arthropod vector. Bartonella, well, you get it when a cat scratches you. That's why we call it cat scratch disease. Rickettsia, well, it depends on the disease and the species. If we're talking about Rickettsia prowazekii, which causes epidemic typhus, then the transmission is by the human body louse. If we're talking about Rickettsia typhi, which causes endemic typhus, then it's transmitted by fleas. And if we're talking about Rickettsia rickettsii, which causes Rocky Mountain spotted fever, it is transmitted by the dermacenter tick. The disease, Anaplasma causes anaplasmosis, Ehrlichia causes Ehrlichiosis, Coxiella causes Q fever, Bartonella causes cat scratch disease and bacillary angiomatosis, Rickettsia causes Rocky Mountain spotted fever and typhus. How can we diagnose anaplasmosis clinically and serology? By looking for antibodies. Ehrlichia, you diagnose it clinically or blood tests. Coxiella, clinically or serology. Bartonella, clinically, serology, and polymerase chain reaction. Rickettsia, clinically, serology, PCR, and skin biopsy. Management of Anaplasma, doxycycline and or rifampin. Ehrlichiosis, doxycycline. Coxiella, doxycycline. Bartonella, azithromycin or doxycycline. Rickettsia, doxycycline. Now let's review. This is anaplasmosis, Ixodes tick. Deer and mice are reservoirs. Flu-like symptoms, fever, and the rash is rare. Expect granulocytes with cytoplasmic morulae. Diagnose with antibody test. Expect pancytopenia, which means low red blood cells, low white blood cells, and low platelets. And the treatment is doxycycline. Next, Ehrlichiosis. It's a gram-negative rod and intracellular. Lone Star tick. Deer is the reservoir. Symptoms include fever, flu-like symptoms, and again the rash is rare. We diagnose with serology or antibody test. Expect pancytopenia. Now we see monocytes, not granulocytes, with morulae. And the treatment is the same, doxycycline. Third, Coxiella burnetti, intracellular gram-negative bacteria, aerosol transmission, affects people who are in close proximity to animals. It causes Q fever, flu-like symptoms, atypical pneumonia, hepatitis, and endocarditis. Diagnose with serology, treat with doxycycline. Next, Bartonella henselae. It's a gram-negative, pleomorphic bacillus. It causes cat scratch disease, characterized by lymphadenopathy, and bacillary angiomatosis, especially in patients with HIV/AIDS. Bacillary angiomatosis mimics Kaposi sarcoma. Bartonellosis may be associated with reactive arthritis and the non-caseating granuloma. Treat with azithromycin or doxycycline. And last, we have Rickettsia. It requires NAD and coenzyme A. It causes Rocky Mountain spotted fever, which ironically does not occur in the Rocky Mountains. Rickettsia species can lead to typhus, Ehrlichiosis, Q fever. The vector is an arthropod. Headache, rash, and fever are common. Keep in mind that in Rocky Mountain spotted fever, the rash is centripetal, meaning it starts on the outside, on the extremities, and then spreads inwards towards the trunk. Diagnose with the Veal-Felix reaction, PCR, etc., and you treat with doxycycline. When you click on the link in the description and subscribe to Picmonic, you get to watch more than 1800 Picmonics. There are Picmonics for all of these bacteria. and fungi, and viruses, and parasites. And it's not just for microbiology. They have Picmonics for anatomy, physiology, biochemistry, pathology, psychology, internal medicine, and more. My favorite Picmonic subjects are microbiology, pharmacology, genetic diseases, and OBGYN. Whether you're studying to become a doctor, a nurse, PA, pharmacist, PT, OT, etc., Picmonic has a solution for you. And don't forget to download the app on your phone. The link is picmonic.com/VIP hookup/medicosis. Thank you, lovely people, for watching. Thank you, Picmonic, for sponsoring this video. I'll see you in the next time. As always, be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.